Hey everyone. I think the importance of vitamin D as a nutrient here in Canada and especially in Ottawa is something we're all well informed about, for general health. When it comes to polycystic ovarian syndrome, vitamin D has a very important role, and I think it's underestimated how important a nutrient like vitamin D for polycystic ovarian syndrome actually is. And so, before we even dive into the role of vitamin D for PCOS specifically, for reproductive health, menstrual health, heart disease, and all these things associated with PCOS, I think it's very interesting when a patient with polycystic ovarian syndrome presents to different healthcare providers. They see it almost as a different type of disease or a different type of condition. So, if you go to your family doctor, they might instantly think irregular cycles. So therefore, we should put the patient on birth control pills. If you go and see your gynecologist, they might be looking at the cardiovascular disease risk. So they're looking at, metformin and lifestyle changes. If you go to a fertility doctor, instantly we're thinking about lack of regular ovulation and low progesterone. So you might be recommending something like Clomid, letrozole, and then progesterone hormone supplementation after ovulation. So I think it's just interesting with PCOS. It's one of those conditions where how we treat it and also how we see this condition differs based on the lens that we work with or the perspective, we see through for patients and the patients that are treated by that healthcare provider. But realistically, deep down in the root condition of PCOS, we have to look at what are the underlying factors because if you just take something, for example, to help with the menstrual regularity, you haven't addressed all those other issues. You haven't looked at the increased risk for mental health conditions such as anxiety and depression, increased risk for diabetes, heart disease, stroke. You haven't looked at the aspect for weight gain and obesity. And so we start to miss these other components which impact your quality of life because PCOS is not just you're having irregular cycles. There's a whole list of conditions that are associated with this one condition. So when we look at the root causes of polycystic ovarian syndrome, we want to look at what are the underlying hormonal imbalances and how can we help to correct those. What are the lifestyle changes, the dietary changes, which have been shown from an evidence-based perspective to support the treatment of polycystic ovarian syndrome and which can help to reduce a lot of the symptoms, reduce the risk of a lot of these uh, co-conditions that can occur with PCOS that we listed. And we also have to look at how can we basically help to improve the overall quality of life for this patient, not just the one symptom that they're coming in with for today. It's how can we reduce the risk for all these other conditions down the road or other conditions that they may have but may not have vocalized to the healthcare provider. And so one of the main things we look at in addition to the hormonal imbalances, diet, lifestyle, um, mindfulness, mental well-being, reducing stress, reducing inflammation is actually nutritional deficiencies. And nutrition is one of those things that has a magnificent impact on a condition like PCOS. And specifically with vitamin D, it has a very key role. It's been found to be correlated with an increase in the production of something called sex hormone binding globulin, or SHBG, is the short-term format that we use for that globulin. And SHBG is very important in PCOS because it essentially binds to free testosterone in the blood. And the bond between SHBG and free testosterone is very strong. So it's not easy to get that testosterone away from the globulin. And basically, if we reduce the amount of free testosterone available, we can reduce the negative impact of elevated free testosterone in PCOS. And free testosterone has a very crucial role in perpetuating the chronic anovulation, the inability to ovulate, the hair growth, the acne. So just by removing some of this free testosterone, we can start to reduce one of the main root causes of PCOS, or a lot of the cause of a lot of the symptoms of PCOS, which is that free testosterone. And so we've seen in studies that when sex hormone binding globulin is low, vitamin D tends to be low as well. And then when vitamin D is higher, this SHBG also goes high, so it can help. And there was a new study published recently this year looking at specifically the role of vitamin D supplementation and nothing else for a group of patients that had PCOS versus patients with PCOS that took nothing but placebo. And it was very interesting to see that after 12 weeks of supplementing with just vitamin D, and they took about 50,000 units of vitamin D, international units a week for 12 weeks. And at the end of the 12 weeks, what they found was that there was obviously an increase in the levels of vitamin D in the blood. There was an increase in the amount of sex hormone binding globulin. These were statistically significant increases. There was a statistically significant decrease in free testosterone circulating in the blood. And they also saw a decline, a statistically significant decline in the severity of hirsutism, the excessive hair growth. And it's important to mention that they also saw improved cycles, so there was improved cycle regularity. And in addition to that, on ultrasound, there was an improvement in the morphological characteristics of that ovary as well. So we're seeing less cysts and less, of an image that looked, like the class book, textbook definition of PCOS. So it started to look like a healthier ovary. And, with PCOS, we can start to see either ovaries that are enlarged, the volume of the ovary becomes bigger, and usually we start to see increased numbers of cysts. So they're seeing more of a more normalization or towards healthy morphological features for the ovary in these patients just by supplementing with vitamin D. So when we look at, all the different types of interventions that are available, I love vitamin D because the risk of harm from something so simple is so low. So we always check, for patients that come in, we always check the blood level first to see exactly where it is. And that tells us how much we should be supplementing with because maybe that patient already has good vitamin D. Now, if you get to a toxic level of vitamin D in the blood where you're taking too much, yes, there's always a risk of harm. But in Canada, in Ottawa, we see a lot of patients tend to have low vitamin D. So, but just determining the blood value gives us a better understanding of how much we should prescribe. So it's safe for you and for the patient, right? But something like vitamin D, if we look at how simple it is and how much of a profound impact it can have, perhaps this is something that's overlooked. Why do patients with PCOS have waning and waxing symptoms? Why is it like they're great and then all of a sudden, after a few months, the symptoms start to come back or worsen or the cycles go in, then it improves again. Sometimes there's a lot of underlying factors, but vitamin D is one of those key simple things that I find gets overlooked for PCOS. We recognize the role of vitamin D for osteoporosis, for calcium homeostasis and balance in the blood. But with PCOS, it's a very vital thing to look at. And vitamin D has, a significant impact on the immune system, on production of different hormones, and with it can also impact potentially mood. This is something that's well established, but there's early studies finding perhaps an association between different mood disorders and vitamin D. So something simple like vitamin D is something we definitely want to look at in addition to a more holistic approach for PCOS. But it's something simple that if we just supplement with, patients might see a greater improvement with. And like I said, vitamin D has a whole host of other potential impacts on the body. It's used for so many other things. And it's also important for the production of an important hormone called anti-Müllerian hormone. And so has, a significant correlation between this hormone, the AMH, anti-Müllerian hormone, which is used as a predictor for ovarian reserve and vitamin D status. So sometimes just by changing vitamin D levels, we can affect the levels of this AMH hormone in the blood as well. So it's just important to mention this because I find it something that's easily overlooked when we're treating something like PCOS. Patients may jump straight to, okay, we're doing birth control or metformin or other interventions without looking at things like lifestyle, dietary, nutritional changes, which can often go very well together, hand in hand with conventional medication as well. So it's not that it should be one or the other. I just think this is an important foundation to look at when you're treating PCOS. And this is why we see so many patients that just by treating these underlying, causes and this building this healthy foundation, which we've seen, from clinical evidence can support better outcomes with PCOS, why so many of these patients start to have regular cycles, why they may get pregnant on their own, and why they see an improvement in or reduction in a lot of the uncomfortable symptoms associated with PCOS, and why they might start to have regular cycles and ovulation. So it's an important thing to incorporate and discuss with your healthcare provider if you have PCOS or know someone with PCOS, to look at the vitamin D levels and to see if that's something that just by supplementing and resolving that vitamin deficiency may be beneficial for you.